So I think for me, the question of why integrative medicine now, there are three big factors that come to mind. I think the first one is the issue of chronic disease. So we know that with COVID-19, this is really critical because it's a matter of life and death. You know, if you have a chronic disease like diabetes or heart disease or obesity, you're approximately 3 times more likely to die from COVID-19. So I think that 60% of Americans have a chronic disease, and those statistics I think are really sobering. Even young people who are obese are much more likely to be hospitalized, even if they're otherwise healthy. So I think that the issue of chronic disease is really relevant now. And we know chronic disease is driven by diet, lifestyle, environment, and behavior. And I would argue that conventional medicine does not have strengths to address those areas, whereas integrative medicine uniquely is well positioned to address those, as Dr. Martin has explained. So I think that's the first aspect in terms of chronic illness. Second, I think that there's an epidemic of isolation and loneliness, which had been occurring even before COVID-19 hit. So we know that rates of depression, rates of self-reported loneliness, rates of isolation have been higher than ever before and have been increasing over the past few years, not just in the United States, but in other countries as well. And we know that, moreover, these have very significant impacts on health. So the former Surgeon General, Dr. Vivek Murthy, had quoted that loneliness is something that has an effect equivalent to smoking 15 cigarettes a day on health. So it just indicates that these other factors like isolation and loneliness have a huge impact on our collective health. And now, of course, it's gotten so much worse because we are at home and not able to connect the way we used to with our peers and our colleagues at work and family. So I think that this situation with isolation and loneliness has just gotten much more amplified. And that's where, again, as Dr. Martin said, integrative medicine is aware of that, the social aspects of health, the mental, the psychological, and by addressing all those holistically, I think it can help with addressing that aspect. And then finally, I think this issue today, in our society in terms of racial inequality and injustice, I know it's been all over the news. So there's a big effect in health as well. So I think COVID-19 has really illustrated that the virus shows us our own sort of inequalities. We know that people of color have been disproportionately affected by COVID-19, far more from a percentage basis than what we'd expect based on population numbers. And also people of color are at a much higher risk of chronic disease, which we know is one of the main risk factors for serious negative outcomes with COVID-19. So I think that it's really just kind of highlighted the racial inequalities, the sort of health disparities that we have in our country. And I'll be the first one to say that integrative medicine has not really been strong in addressing that aspect because in terms of bringing integrative medicine to underserved communities, that's been a challenge that we in the community are aware of and striving to work towards. But I think that this issue as well has been laid bare, just how much racial inequality plays into this. And I think that integrative medicine must address that challenge as well of not just being medicine for, wealthy people, but really for all people, and being able to provide the information and the behavior change to, all communities throughout the country. So I think for those reasons, I really feel that now it matters more than ever.